Heated words with the future of women's health in Texas on the line. Texas' fight with the federal government over funding for the Women's Health Program has raised questions about its future and the 130,000 women it helps.
But a report says the program works the way it is, and it's saving the state of Texas millions of dollars. Just to get you up to speed.
Texas won't give any money to Planned Parenthood, which serves nearly half of that number because of its ties to abortion providers. So the federal government is refusing to give Texas any money at all. And now the state plans to create and pay for a new program on its own. Our Josh Hinkle walks us through this latest development.
Well, keep in mind the Women's Health Program doesn't fund abortions, but instead things like health screenings and birth control for low-income women. At the same time, both sides were throwing punches during this week's public hearing. The state's Health and Human Services Commission quietly published this report. It says last year the Women's Health Program actually saved around $54 million by helping to stop more than 8,200 unwanted pregnancies through prevention.
Allowing a woman to have access to family planning so that she can prevent a pregnancy that she is not ready to have at that time. The state saves dollars by not having to pay for that unintended pregnancy.
State Rep Donna Howard's been one of the most vocal during the women's health controversy. She says it's simple math. Keeping the program alive will mean less spending in the long run.
Not only would that result in healthier mothers and babies, but it would also result in huge savings in terms of our Medicaid costs because it costs significantly more to pay for a Medicaid birth than it does to pay for preventive health services.
It just makes good financial sense.
So why change a system if it's not broken? The Health and Human Services Commission says it's tied by a new state law that in the end means federal funding for the program isn't possible. Here's the breakdown. Last year it served about 115,000 women and cost around $40 million. Without the federal money, the states decided to take on the program itself, and that means paying for it too.
Medicaid in Texas pays for more than half of all births. It takes up a quarter of the state budget.
Plus, last year, lawmakers cut 2/3 of the state's family planning dollars. Less money, and now this new challenge to fund the Women's Health Program on its own. The commission says to do that, it will reduce overtime, put a hiring freeze in place, and recover money from Medicaid fraud. But Howard says there are no promises those options will work. And without the Women's Health Program in place, Texas could suffer financially.
There are still a lot of questions about how we could really implement this at the state level.
And critics worry without Planned Parenthood, there won't be enough providers to take on so many low-income women in this program. But the commission says it's added about 500 providers over the last couple of months to make sure there is a strong base. Planned Parenthood, however, has filed a legal appeal to still be part of the program, which would mean federal funding might still be an option. But as it stands right now, the commission is still set to make that change in November. And if you want to see for yourself this report, just how much money we've saved in the state because of this program, log on to KXAN.com and search for this story on the homepage. Josh Hinkle, KXAN News.